Welcome to the Cambridge Health Alliance Health is Wealth. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance, including the PACE program. And today I'm excited to have our guest is Christian Lanphere, the administrator of the now known as Everett Hospital. Welcome. Thanks for coming on board, Christian. So the Everett Hospital was formerly known as...
It was the Whidden Hospital, yeah. So the Whidden Hospital has been known, for years. In fact, we hit our 100th year mark with the Whidden Hospital. One thing I think it's important to talk a little bit about the Cambridge Health Alliance is sort of our legacy and sort of how we connect with the Whidden Hospital was that Georgia Whidden herself. She donated her estate to serve as a public hospital. So, back in the late 1800s, she gave her only home to serve 12 patients who were indigent, didn't have any real way of getting any care.
Now, was she a nurse or anything?
We don't know a lot about her.
Oh.
And we don't know of any descendants that are still around that have any background on her. Mm-hmm. But she was known, what we do know is through the deeds and sort of what her will was, that she wanted to leave a lasting impression for those folks who didn't have the ability to get care. And this is going back, well over 100 years.
And
we still honor her. We still name, part of our building is named the Georgia Whidden Space. Mm-hmm. Why did we change the Whidden name? The real reason why we changed the name is to make it really reflect sort of the Cambridge Health Alliance as a whole. We have Cambridge Hospital in Cambridge, we have Somerville Hospital in Somerville, and so it really made sense to really coalesce the rest of our third institution after the community that it's in.
And from my standpoint, when I would say we had the Somerville Hospital, the Cambridge Hospital, and the Whidden Hospital, if people weren't familiar with the area, they'd say to me, "Where's that?" That's
right. I think that's I think it's a very common misconception I think what folks get is we think that folks know where it is, and people don't know where it is. But I think what's important about it is that what we want to demonstrate as a community and as a hospital system, that we are there for the community, that we want to continue to dig our roots further into the community and really serve the community as a whole. And that's
so we're carrying on her mission.
That's right. And that's important to us as a whole. So as a community hospital, we provide a wide variety of services, but ultimately our goal here is really to continue to serve the community that we've been, I think, really had the privilege of serving.
Right, and we take we'll take care of anybody.
We take anybody who comes in our door, and so I think it's important as a community hospital. On the backdrop of many of the major Boston teaching hospitals, anyone who comes in our door will get the same standard of care. If they require a higher level of care, how it works is that those patients will be transferred into the Beth Israel system, since we're an affiliate of the BI.
Right.
For children, we transfer them through the Mass General program, only because BI does not serve. They're primarily serving adults. Mm-hmm. So it's important that folks understand that anyone who comes into our building who requires care far more than we can provide, we will always transfer those patients into an acute care setting that can properly manage them. So anyone who comes in, we will treat anyone who walks in our door, and we will manage them appropriately. And if we have to, we will transfer them to a higher level of care if it's needed. So that's important to know.
That's wonderful. Now, how long have you been administrator?
So I took over the hospital about a year and a half ago. Mm-hmm. Deb Murphy was the prior administrator of the hospital. She was there for 10 years.
Wow.
I feel very lucky that Deb was she was a very big innovator. Mm-hmm. She really did really kind of brighten the hospital up. She really tried to improve it. So I really got to ride on her coattails. And so I've sort of taken my own image and tried to improve not only our services, but also the improvements in the infrastructure to the building as well. So I think you'll see, as you come up to the hospital, I think it's more warm. As you come in, we've made more modern updates to the facility. The things you don't see have been greatly improved. Not only the medical technology that we have available, we're right up there. We compete right up there with any other hospital in the Boston area.
So tell us about some of those things that we have.
Well, so I think one of the things that's important. First off, we're part of the Harvard teaching hospital system and the Tufts Medical School program for family medicine. So those are the two areas that I think that we're very proud of our affiliation with them. But our emergency department is actually the 6th busiest emergency department in the state. So we're gearing it for over 50,000 patient visits a year.
Wow.
And so they are a very, very busy emergency department. And I must tell you, they're all board certified emergency medicine physicians. And they rotate, but the great thing is that they all rotate to the 3 emergency departments. So they get to see a wide variety of patients, and they're looking at a wide variety of care. So regardless if you get your care at Somerville Hospital, Cambridge Hospital, Everett Hospital, the emergency room docs are really, they work in all 3 and they rotate.
They have the experience.
So they're well known into the community and they've seen a lot. Now, of course, one of the things that I think most folks are really talking about today is the opioid crisis. And Everett Hospital in particular, not only I'm very fortunate that our chief of emergency medicine for the Everett Hospital, she's also dual certified in toxicology. So not only do all of the patients who are part of this opioid crisis coming literally in crisis, we are saving huge numbers of patients because I think we're well experienced in managing these patients, but also having that toxicology background, I think has been a huge asset to us as an organization.
Wonderful.
In addition to the emergency department, one of the great things that we recently opened up was a pulmonary rehab program. Now, my mom passed away about 6 months ago from COPD. And
COPD.
COPD is chronic obstructive pulmonary disease. It's actually grouped to a number of pulmonary type diseases. But with that, and I really guess never truly appreciated just, I think, sort of watching many years, watching someone slowly begin to just lose air. And so Dr. Alex White, who came to us from the Steward system, brought in a pulmonary rehab program. And we have seen huge success out of this program. And so we have, many of our patients who are, predominantly, probably, 50 and above. Probably many of them are prior smokers for many, many decades, who are now starting to have some type of lung disease. Some of them, those patients who are walking in, literally in wheelchairs, or they just simply, as they're walking down the halls, they simply just cannot catch their breath. It's a 12-week program that they're fully monitored from a medical standpoint. They're reviewed, accepted into the program. And over a 12-week period, through education, through exercise, many of these patients are walking out the door on their own.
Wow.
It really is a great, great program.
So do you have to be a CHA patient?
No, you do not have to be a CHA patient.
That's important for us.
And that's important, right? And so if you are referred to us, you do need to go through the evaluation program. You will need to be seen in our medical specialties clinic, one of our pulmonologists.
So there's an assessment.
There's assessment has to be done. There's a pulmonologist that will sit down with the patient, go over the plan of care. If the patient is accepted into the program, then we have a group of folks who will follow up with those patients. And believe it or not, we've been having more and more guests come into the hospital. And the goal is we want folks to really start to see and learn more about our little hospital. And it's really truly what we call the gem on the hill. And many of the elderly population, particularly in what we call the Malden, Chelsea, Everett, and Revere area, they haven't heard of this. They haven't heard of a program like this before. And so many of them have been getting more and more interested. And so right now, unfortunately, the program is getting booked up fast, but we're bringing on more staff to help provide more opportunities for folks to get involved. And we're seeing a lot of progress. And so it's a great, great program. And I'm very appreciative to Dr. Alex White for not only his vision of bringing it to the hospital, but also I think we're seeing a difference in the folks who live in that area.
Right? Breathing is not overrated.
That's right. But we also have a number of other specialty services that are not only provided at Cambridge Hospital, but also are provided up at Everett Hospital as well. So particularly any of the patients who are followed by our primary care providers in the Malden, Everett, and Revere area, we do have specialists that they will be seen up at the hospital. So we have board certified, a wide variety of board certified specialists and surgery capability in the hospital. So we're a full-fledged, classic community hospital. The only thing we don't do is we do not have a labor and delivery program there, but have no fear. We've had many women who have come in ambulances with little ones on the way. We've stabilized them and we've moved them on to Cambridge. Where
Have we delivered anything?
We have delivered. We've delivered a number of kids at the hospital. I think it's certainly one of those areas where I think the staff are glowing. You can see, I come down to the emergency department, you can see a lot of staff are smiling. I think they're very proud of the work that they do. Mm-hmm. So that's been great. And our radiology services are top of the line. We have advanced CT, MRI programs.
CT is?
It's the CAT scan. So that's what folks should probably understand. Other than computer tomography, it really is most commonly known as the CAT scan, where we can take pictures of your brain. We can take pictures of your abdomen and chest. So nice program. It's state of the art. Our radiology program is all digitalized. So our providers, radiologists, if they're not up at the hospital, they're at Cambridge Hospital. Patients their films are reviewed very, very quickly. They're also transferred immediately to the emergency department. There's just a lot more opportunities for us to get a definitive diagnosis on the spot for patients with better technology today.
Yeah.
So
wow, that's wonderful. That's wonderful.
It's great.
So you have other changes, like physical changes to the outside of the hospital as well.
Yeah, so we've really cleaned up we started to engage with the neighbors around us. I think like in many other community hospitals, we're right in the middle of neighborhoods. We want to improve our relationship with our neighbors. So we've engaged our neighbors and find out how we can collectively together improve the area around the hospital. So we've done a lot of work not only on the outside of improving the infrastructure, but improving the image on the outside of the hospital as well. So I think if you come up there, I think you'll find it to be, and of course it's on the top of a hill, you'll find it to be a warm, inviting environment now. And so my whole thing is, keeping it nice and pleasant and welcoming. I think people will come. We have seen that. We've got gardens. We've got some. We have what I call a green space that we're working on now. It used to be a parking lot. We closed it off, and we're looking to develop that area now into a green space, and with the hope that people will make use of the time back there, and it'll just become a nice space for people to get away, and that's really our hope.
And the energy of the greenery, which is so important to us, and we tend to relax in that space.
I think people just, especially in the summertime, if you ever go up to the hospital, it probably has some of the most spectacular views of the Boston area.
It truly does.
It really, really does. And so I think many folks who come up there are always reminded, like, I've never seen views quite like this. So I think it's just nice, a nice way for the staff, patients who are probably, they're not feeling so well. Maybe they just need to get some fresh air. It's a nice place for people to go. And so we'll be developing that over the next year. And so it'll be a nice place for people to relax.
Now we have, and I'm involved in this, we are opening the doors more to the community.
Absolutely.
And becoming more of a warm and friendly place.
Well, what I want people to really know about the Cambridge Health Alliance as a whole is that we are a warm, welcoming place for anyone of any background, and so it is a safe place. People will get great care, and we want to continue that tradition both in Cambridge, and we want to make sure that's occurring in Everett.
Right.
So
it amazes me always, and I found out a lot of information on the show. I say that's why I do the show. That for a community hospital, we do incredible things.
We do. There it is.
And a lot of incredible things.
Yes.
A lot of variety of incredible things. So
it's nice to go out into the community. It's nice to hear the great work that the staff do. I think the staff up at the hospital are some of the kindest people. They truly advocate for their patients on many, many different levels.
It is true.
There are, we have many people who have a wide variety of life issues, and I think our staff go to great lengths to really try to find a better plan for a lot of these folks who come in the door. We want to make sure that they leave better situated than they came in. And
The one thing that I've always found, because with my job, I take doctors out to the community, and of course I had docs come on this show as well. But in watching the docs interact with the community members, they're very approachable.
Yes.
They introduce sometimes. Some of them introduce with their first names.
Yeah.
So they are. It's a far cry from the doctors that I grew up with, that were like gods, basically.
Sure.
And they just are much more approachable, and they are much more willing to listen to what the patient has to say than the docs I grew up 100 years.
I think I consider myself to be fairly young still, but
You are.
One of the things that I really got to learn about the staff at the Everett Hospital is that last year I hosted a group of nurses who graduated 50 years ago from the Whitten Hospital Nursing Program, when many nursing programs were affiliated with a hospital. And they reminded me of just what it was like when they were going through schooling, and when they started taking jobs within the hospital, just how different just one good thing that really stood out for me was that it was very common for healthcare workers to smoke while treating patients. It was not uncommon. And so, for me to really try to envision what that was like, they got to tell many stories of the sort of the things that happened. And they were really, they were a great group. I thoroughly enjoyed having them, but they really demonstrated to me just the passion that they had for nursing. And for many, I also got to learn that many of our staff members who graduated 20, 30 years ago from the Everett or the Whitten School of Nursing are still there today.
Wow.
So
there's a lot of longevity.
They have a lot of experience. They've been there. They've seen many different shifts in the community, and they are very attentive to many different cultural backgrounds. So that it's
important.
It's very important. But not only their cultural backgrounds, but also to languages. We see so many patients who come in the door, and visitors as well, who are just frightened. I don't think that people want to come to the hospital, but when they come there, we don't know what they're there for. I don't know if they're being told bad news, or if they're there to get a follow up on a procedure that might have happened. But people come in our doors for a wide variety of reasons, and our job is to make them as comfortable as possible, having no idea what shoes they're walking in. Not to mention, they may not have an ability to understand us. So we have a very, very large and very well organized interpreter service system that allows our patients, regardless of the type of their background and their language, to be immediately connected with an interpreter, so that we can adequately communicate to the healthcare team about sort of what their challenges are, what their their problems they may be facing are. And it's a great,
and maybe a little
great
insight into the culture.
Absolutely, and I think we've learned a lot too, a little bit. In folks that we're not so accustomed to, we ask them. We're very upfront about what is it that we can do to make your stay better. Mm-hmm. And some of them have given us their cultural practices. Great thing about Cambridge Health Alliance as a whole, we honor and we are respectful of all cultures. One of the areas I think we're also very, very proud as an institution, and I don't think many patients, visitors who come into our system probably get to see what we call MDR. So we call it the multidisciplinary rounds. So every morning around early in the morning, we have all of the physicians, the residents, which are still training in their training, the nurses, physical therapists, case managers, nurse managers, respiratory therapists, all come together and they go through every single patient.
Wow.
They know so much about the patient and sort of what obstacles they may have. Now, a good example is for a patient who may have some type of respiratory ailments. What we want to know is, well, what floor do they live on? Do they live on the third floor? So in these rounds, our staff will come together and they will talk about this patient lives on the third floor. There is no elevator. So it's great if we can get the patient upstairs. The problem is now getting them out, getting them so that they can get food, they can continue on their life, may be enormous challenges. And so our staff as a whole want to be aware of, while the patient's in the hospital, we can manage them, but once they leave, more importantly, we want to know that they continue to be safe leaving. And so in these rounds, and I get to hear many of the providers, many of the staff talk about what challenges we can do to help these patients. Our case managers are phenomenal. They get them into services, they get them into programs so that we can, when they go home, we can make huge improvements in their life so they're not actually ending up back in the same situation they were earlier. And I think that is it's a program that I don't think that folks are aware of, but it is a program that we've been doing both at the Cambridge Hospital and the Everett Hospital, and we do it every single day.
Wow.
And they talk about every single patient on that floor, and everybody's in agreement about what the plan will be for that patient during their stay. So it's a great program, and we're very happy to have the program.
Right.
And the staff also are very happy to be part of the program. So that's important to us.
I think it's important to everybody, even the people that come in, and
That's right.
most importantly, the
That's right.
people that come in and get sent home with appropriate services to support them in their community,
Correct.
right?
That's right.
So we are doing some community efforts as well.
Yep.
We have launched our senior supper,
Yep.
which we had our first event, which
It was very fun.
was fun.
I think the visitors, I think that they loved it. I think they had a good time. I think there were a few who were a little afraid to get up and to learn to dance. But you know what? I think some of them got up there and I think they actually genuinely had a good time.
Right, and the ones that couldn't, we did the hula. And
Yeah.
the ones that couldn't, I said, do it from your chair. Right, so a few of them
They did.
participated there.
You know, there was a lot more of our elderly visitors who came up than I thought there was going to be. So I think many of them were much more excited to come up. And I think it's important that they understand that, we are in their community and that we're not just a hospital system that here when they get sick, but that we can also serve as a venue for, I think, relationship building as well.
Right.
I think that's important.
So I think it was successful because I hadn't even gotten the date for our next one.
Okay.
We're going to be doing these quarterly, and I had 5 people register.
Oh, excellent. Excellent.
5 people register without having any of the details.
Yeah, that's great.
So I'd say it was successful.
Yes. I think that people really liked it. People want more of them. We would also been trying to encourage the businesses in the community as well. We just recently hosted the Everett Chamber of Commerce up at the hospital as well, and so we had a nice turnout from them, from the businesses in the community. Again, this is just more relationship building with the businesses, but as well as our community partners, our colleagues in the Board of Health, at the police department, the fire department, the Cataldo Ambulance Service, professional ambulance services. So we really want to continue to build relationships with our partners because we depend on them as much as they depend on us.
Right. Well, I think, if everyone works together, it always works out much better.
Yes, I think
Less people fall through the cracks.
I think there's a lot of, in all of these organizations, there's longevity. So I think there's a lot of people who have been here for years, and they really, I think we all want to do what's best for the community. And the Everett Hospital is in Everett, but we don't just serve Everett. We serve, Malden, Chelsea, Revere, and Winthrop as well, and Charlestown as well. We have many patients who come to us from Charlestown.
Really?
So we have a broad number of patients who come from a wide variety of areas, and our goal is to make sure that they get top-notch care while they're with us. And it is important to me as the hospital administrator to make sure that patients have a good stay, and if they didn't, where can we improve? And right. So that is most important to me. I'd like to go and try to visit with the patients as much as I can. But I also want them to know that we're there to listen, and if we can do something differently, will bring their healthcare team together and we'll work on it. But I certainly leave it to their doctors and their nurses to really lead the way and make sure that they get high quality care. And that's what's most important to me.
Right.
And I think the important thing for me is how many patients who get to walk out that door far better than they came in. And I think at the end of the day, it's a feel good that I think what we're doing is the right thing. Mm. And I'm very proud of not only the Cambridge Health Alliance system as a whole, but the staff, most importantly, who do the day-to-day work and get the awesome responsibility of interacting with the patients and their families, in not always such great situations.
Right.
And that's
right in crisis situations.
And that's important. And I think one of the things that Cambridge Health Alliance is really well known for is our psychiatry program. Mm. And we have our psychiatry program not always inpatient but also outpatient. But it also serves children as young as probably 3, all the way up to folks well over 100. And so we have a wide variety of programs for them, and our goal is to help them not only be safe while they're there with us, but also to make sure that after they're discharged, that they're set up with services so that they can continue to be monitored and watched, and that someone is looking out for them. Right. That they have a safe space that they can go to their provider when they if their finances are an issue, that we can at least try to find some way in supporting them in some capacity to make sure that they get the needed therapy they need, medication and regimen management. Those are the things that I think are important to us. So.
Well, we certainly are doing an awful lot up there, and I know that we only have another minute or so, but I am constantly out here because I deal with the elderly population. Surely. So I'm out here constantly doing damage control for the old Whidden. So thank you so much for coming on board and sharing our vision and our current work and how ingrained and how important we are in the community.
As my case management director says, we are the little gem on the hill. It truly is.
Well, thanks so much for coming on board, Christian.